And a very good afternoon to you. Thanks for joining us on our live stream. I'm Mike Killeen in the CBC Vancouver newsroom. Our topic today is the coronavirus, with more than half of Canada's coronavirus cases identified in BC and health authorities gearing up for a possible pandemic. We've brought in Dr. Srinivas Murthy to take your questions on the disease. Any question at all that you have, because he is an infectious disease expert and has been supporting the World Health Organization in its international response to COVID-19. Thanks for joining us this afternoon. We appreciate it. Let me ask you first of all, as we're waiting for questions to come in, and please fire away. We'll get them to the doctor as soon as possible. Let's talk about the World Health Organization forum earlier this month. You were involved in that forum in Geneva, Switzerland, helping guide the global strategy on coronavirus. So what was your actual role there?
So that meeting was dedicated to coordinating a response, to learning more about coronavirus, the virus, what it does to humans, and how to best control it. And so that meeting was to coordinate all of the different countries, right. Canada being one, but every country in the world effectively, to try and work together to solve the problem.
Well, and what was the outcome?
The outcome is that we agreed on specific priorities that we needed to focus on so that we can stop this outbreak earlier and know as much as possible about it going forward.
Talk a bit more about that, yeah.
So the first thing is trying to understand what this disease is. It's a new disease in humans. Trying to understand what that does to humans, who gets sick, how they get sick, and then trying to figure out how to make them better, how to develop a vaccine, how to give them antiviral medications or any other medications to make them improve from their infection, and what interventions at the community level would work best to prevent transmission from one person to another. All of these questions we really don't have answers to right now, but we're working on that right now to move forward.
Okay, and just give us your sense of the overall situation
Sure.
now from a global perspective.
So I think in China, and readers and viewers are probably aware, the case counts are starting to decline for the first time this week, which is encouraging. At the same time, outside of China, yesterday was the first day that case counts outside of China were more than they were in China. And that's concerning for global spread. Right. Outbreaks in South Korea, in Iran, in Italy, continue to propagate, and that is a sign that further spread is likely.
And in terms of Canada, let's talk about BC.
Sure.
In terms of a widespread outbreak, is it just a matter of when, not a matter of if?
Not necessarily.
Okay.
I think the rest of the world is focused very much on this outbreak, and containment strategies are still, while difficult, possible. And so in these pockets of outbreaks in Italy, Iran, and South Korea, public health authorities are working around the clock to try and keep it within those regions. Obviously, it's difficult, and spread is possible in every country around the world, should become as ready as possible for anything. But containment, while unlikely at this point, still possible.
All right, let's talk about some of the things that we are doing here to try to stop the spread and try to contain it. We'll take some questions, and please fire away. Please make sure you send them on in, and we will get them to Dr. Murthy. So Elnaz Bayal is asking, why isn't Canada screening, and you're going to get a lot of questions like this, I think, but why isn't Canada screening every single person in airports like other countries are?
Sure. The first thing we know is that it's difficult to screen because we don't really know what to screen for. If we screen for fevers, we miss a lot of cases that way. The SARS experience told us that screening at borders or at airports doesn't necessarily catch as many patients as we would like. And they've done lots of modeling studies with this current outbreak and with the flight patterns, showing that airport screening by itself won't catch cases. And so in the end, most countries, while it seems intuitive to do it, are implementing it. Canada is actually following what the best evidence says, that it's not necessarily the best use of resources.
All right. You mentioned SARS. Dominique is asking, how does this virus differ from SARS and H1N1, the pandemic scares, with respect to those two?
Sure. And so it's very similar to SARS in that it fits into the family of viruses called coronaviruses. It's different than influenza. Influenza is a different virus altogether. We know a lot more about influenza. Influenza circulates seasonally, and that pandemic strain in 2009 was a different strain that caused a severe outbreak and pandemic around the world. The coronavirus that's currently circulating is a new coronavirus. At the same time, coronaviruses are common viruses as well that circulate in the community every year. The common cold, for example, is caused by a coronavirus, amongst others. What's notable about this one is that it's A, it's new, and B, it's more severe than obviously the common cold. About 1%, depending on how you look at the numbers of the people who get this, will end up dying.
Okay. And that's a question I think a lot of people have. We've seen several cases in Canada, but people, they're sick, but they're not deathly ill.
Yeah.
That's how it's kind of manifesting itself here.
Yep.
Is that?
Yep, and so we've had, I think, 14 or 15 cases as of now, I guess, and none of them have died, and most of them have been able to be managed at home with some hospitalizations here and there. And that's par for the course for most of the world outside of China. You saw at the very initial parts of the outbreak in Wuhan and Hubei province in China that the rates of death were higher. I think there was a lot of health system strain at the time, and people were unsure of what to do. As we're learning more and more, and this virus spreads around the world and systems become prepared for it, you see the case fatality rates fluctuate downwards. Part of that is we're recognizing more people in the community with infections, with testing strategies. And part of that is the health system is ready for it, that we're looking for these cases, we're actively seeking them out, and then we're reacting accordingly.
All right. Here's a question from a YouTube user. Are people overreacting to the virus? Influenza currently affects many more people than COVID-19. How much more dangerous is this really compared to influenza?
Yeah, that's a common question, and it's a reasonable one. The problem with this is that we still don't know what this coronavirus can do. We don't know what its actual fatality rate. If you look at seasonal influenza, its case fatality rate is quite small. It's like less than 0.1%.
Right.
This is about 1%, so about 10 or at least 10 times the fatality rate of influenza. And so while we're learning about a new disease, it's appropriate to be cautious. Overreacting is a difficult thing to necessarily do, but be cautious.
Okay. Esther is asking if you get the coronavirus and recover, can you get it again? Good question.
It's a great question. I don't know. And that's what we're trying
that's
to
part
help
of the
figure
issue,
out.
right? Yeah.
One of our questions that we had at the World Health Organization was, what is the long-term effects on our immunity of getting one coronavirus infection? Is it likely that we develop a strong immune response to it? And if so, that would be protective. We don't know that yet. We haven't had enough patients, followed them up long-term enough to see if they can be reinfected yet.
Right.
And that's one of the major questions we have to answer. That helps with vaccine design, for example. If we're able to mount a strong immune response, that'll most definitely help with developing a vaccine.
Okay. Any movement on a vaccine?
So there's lots of people working on this.
Yeah,
and I think there's at least 20 in process of being developed. Likely phase 1, which is the very first in human studies, are probably going to start within the next month or two. By the time something is ready to be deployed in the community, at the minimum a year.
All right. Here's a question from Anna asking if people are asked to self-isolate, we've seen quite a bit of that, what happens to their family members who live with them?
That's a good question. And so public health policies differ across every jurisdiction on that exact question. And some places will restrict access to that individual and keep them separate. Some places will keep them at home with their families with close monitoring of the families for symptoms and some very sort of strict precautions within the household. No sharing meals, hand washing, all those things, sleeping in different rooms. And so I would consult your local public health authorities because every jurisdiction is going to have different policies there.
Right, because we've seen a couple of cases where people have tested positive, have been self-isolating, and then a family member contracts the virus.
Yeah, and that's obviously the risk-benefit ratio of how aggressively we quarantine somebody with the possibility of transmissibility within that. And then we get into all sorts of large questions about rights, about impact to the individuals, and so on.
Right. Okay, good questions coming in. Please keep them coming. We are with Dr. Srinivasmurthy, infectious disease expert. And here's a question from Reese asking, should we prepare to keep our kids home from school, stock up on supplies, that kind of stuff?
Not yet. Right now, Canada is well positioned. We're keeping track of things across the world, and with only the handful of cases here, there's nothing really more to do. That recommendation might change. Some jurisdictions around the world are closing schools. Japan, for example, has closed schools. Some schools in Europe are closed. But
someone in Washington State just yesterday.
Exactly. But in Canada at this point, it's not a recommendation. The larger question is, does that even help with an outbreak, closing a school? With children not likely being a major vector, as we say, of transmitting the infection, it may not be the most evidence-based intervention to close schools here. We're still looking at that, and lots of different places are evaluating the use of school closures.
Is there any reason why we haven't seen many young people contract this virus?
It's a fascinating question, and no one has an answer. Once again, we're learning more and more with every single child that gets infected.
Right.
Children seem to be protected both from incidence of having the disease as well as severity of the disease, and that they don't have as nearly a high a case fatality proportion. That's different than influenza, where children are most affected compared to other age groups. There's lots of biological reasons why that might be true for this outbreak, but they're just speculation at this point.
Right. Okay, another question, this one from Adrian, asking what's the plan for smaller city centers that cannot handle the outbreak of this virus?
Hopefully every city center can handle an outbreak of this virus. And that would be the public health plan, that every city should have some sort of resource to handle it. If a patient is severely ill, they would be transferred to an appropriate care center. Looks like any other time of the year. And outside of that, self-quarantining at home or self-isolation at home can be done anywhere. And medication administration and hand hygiene and other things that are required for an outbreak of this magnitude can be done anywhere.
Okay. Question from Scott. I have a family trip to northern Italy scheduled at the end of March, so the end of next month. Is it a good idea to cancel? Is there a chance I could be held in quarantine upon return? So we've seen what's happened in northern Italy and places like Milan and elsewhere. So a question there from Scott.
Good question, and the answer is probably he's not probably going to go to northern Italy on his vacation, sadly.
Don't know. Okay.
In that the travel advisory, I don't think has been laid out just yet, but other countries are starting to institute them to northern Italy. We'll see what happens over the next couple of days to see what kind of trajectory the outbreak takes there. They're instituting all sorts of precautions to sort of limit it and contain it. But the possibility of travel restrictions to that part of the world, unless it's mandatory, may be in place soon.
Yeah, because it's a question a lot of people are asking, you know,
canceling
travel,
vacations. Yeah.
Should I go? Should I not go? Et cetera, et cetera. So,
All
right, Scott, I hope that answers your question. Doesn't sound like northern Italy next month.
Yes. Maybe.
Maybe, yeah. Okay, YouTube viewer asking, does a mask, we get this quite a bit, does a mask help prevent transmission?
It's unlikely. What it does prevent, in the community anyway, that it prevents, if you are sick, it prevents you from transmitting the infection to others. Okay. And so if you have a runny nose, if you have a cough, if you have something like that, yes, no question, a mask is warranted. In the absence of that, it's probably not going to provide you any benefit. That being said, in a hospitalized patient or someone who has known coronavirus, wearing a mask is what's recommended, a specific type of mask to make sure that you're not inhaling any particles.
Tough to find a mask to purchase.
That's a separate issue, yeah.
Exactly. Jim is asking, a good question, does the current flu shot help in any way?
Does, no question. And one of our most important recommendations to get your flu shot. Nothing to do with helping you against coronavirus. It's a completely different vaccine. That being said, protecting yourself against the flu, which has very similar symptoms as coronavirus, particularly right now during flu season, will help the health system sort of figure you out, because you're less likely to have the flu if you come in with flu-like symptoms, if you've had the flu shot, and B, would limit the strain on a possibly strained healthcare system by keeping people healthier at home.
All right, just a reminder, you can fire away with your questions. Dr. Srinivas Muthri is here with us for the next little while. We don't have a time limit on this. We won't keep you all. I know you're a little jet lagged and what have you, but we appreciate you being in here this afternoon. Luke is asking, a good question. Once a person with coronavirus recovers, can that person still infect others?
So it depends on what you mean by recover. So recover could be like feeling better, but you could still have virus in your nose and mouth that's shedding. Whether or not that virus is infective to others is still a question that we haven't figured out. And that's one of the most important questions we need to figure out. And then there's recover in the sense of you're okay to be discharged from hospital,
right,
which a lot of people will say you'll need a negative test to say that you're recovered. And once you have a negative test, it's unlikely that you can transmit it to other people. And so you might feel better, but you still might have virus floating around.
Going forward, right. Crystal asks, what happens if you have to self-quarantine but can't afford to stay home from work? More of a social question, but a good question nonetheless.
It's a
right?
very good question, and obviously not my area of expertise. Sure. And I think that that's part of the planning process for preparing for something like this, that the economic impact will be significant if it becomes at a level that people are staying home regularly from work. And so at a sort of a policy level, that should be implemented, that like, workplaces should take that into account, that people will have a lower threshold for staying home from work, either because their children will be at home or they have to be at home. And I think we need to, as a collective, decide about what the best policy is there.
Right. Because we heard our public officials saying earlier this week that if there is a widespread outbreak, that they would probably tell people to stay home.
Stay home, exactly.
They won't say necessarily for how long,
no,
because that's still unclear. But that would be the first step in trying to deal with this at that level.
Yeah.
Brooke Ellen asking, how long is the COVID-19 incubation period?
Once again, a great question. We think it's around 2 weeks. We think, based on the studies that have been done, and China has been great about getting some of this data out. Much more data is coming out by the day. We think it's somewhere around there. And that's an important number to know, because that determines how long you isolate for and how long you keep people away from others once you've had an exposure. Because if you're okay after that incubation period, then we can say that you don't have the infection and you can go on about your day and your life. And so that number has a huge impact onto how long people stay at home, and subsequently how long they have to stay home from work and the larger economy.
And is the time frame rather of the incubation period, is that why we've seen, people will fly back to Canada from China perhaps, and then be fine on the plane, showing no symptoms, and then a couple of days after they get back, that plays into that.
And that's
time.
exactly that.
Right.
But that's within that 2-week window. And so folks who came home from, I think the Diamond Princess the Diamond Princess cruise ship off the coast of Japan, they were kept in quarantine for 2 weeks, I believe, just for that reason. Right. So that it's an incubation period for the virus before you develop symptoms. And if they did not develop symptoms, they can be returned back to their households.
Okay, keep your questions coming. We're with Dr. Srinivas Muthri, infectious disease expert. He's been involved with the World Health Organization and coordinating the international response, and is here to answer your questions this afternoon. So, Jamie is asking, there was an article on social media that said a dog had tested, of course on social media, a dog had tested mildly positive for the virus. Is that true? I don't know if you're able to answer that, and should we be worried about transferring the virus to our pets and animals? That's perhaps a fairer question.
The first question, I haven't actually heard that before,
Okay,
and so I'd have to learn more about it before I can comment on how true it is, what test it was, and how weakly positive it may be. Like any test, there can be false positives. And so I'd like to learn more about that to see what impact that would have. And then second question is, does it infect animals? And that's an important question, and we don't know where this virus came from an animal host perspective. And so can it infect animals? Maybe, sure. Once again, we don't know. And that's another major question to figure out going forward. Can it infect our domesticated animals, our dogs and our cats? It's unlikely, to be truthful. And it's unlikely that those dogs and cats can be vectors for the infection, transmitting it to other humans, but it's something to consider.
Okay. William Brown is asking, so if this is flu season, what happens in August when it's not flu season anymore? Does this thing only last a few more months?
That's once again, a good question. So that's the hope, that as the summer comes, that these viruses, given they prefer the colder temperatures in the northern hemisphere, will start to dissipate, coming back again, in theory, next winter. Maybe. We don't know that for sure, and obviously in places like Singapore or Hong Kong, where they don't have the seasonality that we do, they're having ongoing transmission. So unclear as to what the impact of a changing season will have on this coronavirus outbreak. It might be to our benefit, given that it's March very shortly, and giving us time to prepare adequately.
Okay, question from Stefan. When is the most contagious stage of the virus?
Good question. We think it's when you are at the most sickest. And so the patients who are in the hospital who are very sick have been noted to be the most transmissible in some of the Chinese case series.
Right.
And so if you have mild symptoms and then you recover, you don't have as much virus as someone who is very sick, who has higher viral loads. Are you more transmissible in that context? Maybe. And that's the most plausible hypothesis right now.
Okay. Tara Lynn is asking, do we know if coronavirus can be transmitted through water?
I don't think it can.
All right. Anastasia asking, should traveling to the USA be avoided?
Not yet. The USA does not have any sustained human-to-human transmission chains that we don't have track of. There's been a case or two recently of patients who've been reported to be positive without a clear link to another case or a region of interest. And so those are being worked on by the authorities down there, but it's not at a point where the US becomes a travel-restricted place.
Okay. Another question, would additional cleaning of surfaces in public areas like food courts and shopping malls perhaps slow the spread?
Yeah. I think in general, those public health approaches are recommended. The virus likely can survive on inanimate objects for a period of time. We don't know what that period of time is, and we don't know what inanimate objects are more optimal for a virus to survive. And so the precaution of keeping your surroundings clean is a good one any time of the year, but especially now.
And how many people have you told to wash your hands?
Always, always.
Exactly. Here's a question from Flores asking, how would you know you have coronavirus?
It's difficult. It's to tease it out from cold or a flu or something else, it's almost impossible. And so at this point, where we are following and we think most of the cases are coming from specific regions, we would look for a travel history to one of those places, plus the symptoms to say, I'm suspicious of this being coronavirus infection. If it becomes more sustained in the community and that the disease is transmitted without clear linkages to other places, then it will be next to impossible to distinguish it from the flu or other tests or other diseases. And so then it's going to be a diagnostic test that's going to help us.
And is the test faster now?
It's getting better. I'm going to defer to my colleagues over at the BC CDC who can give you the exact timeline as to how fast they can turn it around. But Vancouver and British Columbia have been getting ready for this for quite some time, given the experiences here over the past 20 years with SARS and so on. And so they have a strong public health infrastructure and have a strong diagnostic lab and are able to put a lot of samples through, and a lot of attention is being paid to just that for that reason. Distinguishing it from influenza, distinguishing it from the common cold is an important thing to do.
Because I think until just a couple of weeks ago, we were still having to send the test back to Manitoba. For confirmation.
And so they've scaled up pretty aggressively here.
Right. Okay, Gary is asking, it's hard to believe that not closing borders to seriously infected countries doesn't work. Please explain how this can be.
Yeah, this is a common question.
Right.
And the first point is that closing borders is difficult to do, and that people will always find a way to leave their country if they want to leave their country. And there's nothing you can do about that.
Right.
And that's a fundamental truth. The next thing is, does that help with containing the infection? Yes, in the sense that if the country is very small and controlled, like if the country was Wuhan City, for example, and they closed that down, yeah, maybe it slows things down. If the country is 1.5 billion people, completely closing them off from the rest of the world is impractical, infeasible, and doesn't match the science of the proportion of people who are actually infected. And so it's an option, but it's not necessarily one that's based in evidence, and typically will lead to more problems rather than not.
Okay. A question from Tina. Most people in Metro Vancouver take public transit, such as the train, the bus. Should we be worried when taking public transit, and what can we do to protect ourselves on the train?
Not yet. With no community transmission of the virus here, public transit is perfectly safe and recommended, in fact. Obviously, if there becomes a sustained outbreak here locally, then that recommendation might change.
Okay. Question from Alexandra, and keep the questions coming. What's the best way to prevent getting COVID while traveling on planes? Again, a question about the masks, which we hear quite frequently. Would they actually help?
Probably not, once again.
Okay.
The best way of not getting infected on a plane, and there's no real good answer there. Once again, hand hygiene is very important. The most common way a virus is getting into your nose and mouth is with you rubbing your nose and mouth. And so avoiding that action, keeping your hands clean. Outside of that, there's very limited actions that can be taken.
All right. We still got, we'll keep it going for a few more minutes. A lot of people asking about travel to Mexico. Is it safe to travel to Mexico?
Yeah, at this point, there's no reason not to.
And the phrase that we're hearing now is the community transmission.
Yeah.
Talk a little bit more about that.
So right now we follow chains of infection. And so if we see someone who has an infection, there's a lot of tracing of everybody around that person to follow them to see if they become infected. And as of now in Canada, all of the infections have a clear link to somebody else, and they can be traced. Community or sustained transmission is when we sort of lose track of that. And then the infection becomes more unpredictable in the community, and then more likelihood of, say, restrictions on bus travel or plane travel or so on.
Okay. Jennifer's asking the vaccine question again. How far off until the vaccine might be ready?
Difficult to say. Things are being sort of actively worked on, a lot of money and a lot of attention on the subject. Obviously, that would be the best solution, but most likely a year before something's ready to go. First studies are probably starting within the next couple of weeks in phase 1 studies in humans, and then it takes a while before we decide what's the most effective vaccine. We worked on a SARS vaccine for quite some time, and there were some problems with some of the development of that. And so learning those lessons and then applying them currently, vaccine technology has grown substantially over the past 20 years, and people are able to, smarter people than I are able to get something going pretty quickly.
And do you think, is China's transparency and sharing of information helpful when it comes to that?
Yeah,
because of where this all started?
Yeah, no question. I think the virus strain was released to the public, and the sequence was available within, I think, days of an outbreak being declared. And data about each individual patient is being shared with frequent publications in the literature. And so they're sharing that degree of data, which is without a doubt useful for the rest of the world to prepare, to design the studies to evaluate the vaccines and to have the science of the biology of the virus to help generate vaccines and therapeutics.
All right. We've been going for almost half an hour now, so why don't we wrap up with this question, perhaps appropriate. Are there any ideas at this point as to how coronavirus will be stopped?
Great question, and I think there's 100 different ways that it will be stopped. It will be stopped with all of us, paying attention to it and practicing good public health. It's It'll be stopped by maybe getting a vaccine within the next year. It'll be stopped by having good antivirals or other medications to help people get better. It'll be stopped by us collaborating with the rest of the world to help them stop it themselves, especially in places in the world where they don't have the infrastructure that we have, and we can help build that out. Canada's pretty lucky in that we've had experience with these outbreaks. A lot of the world has not, and so sharing some of that experience would absolutely be valuable.
Thanks for coming in and doing this. We appreciate it.
Of course.
Lots of great questions. Dr. Srinivas Murthy, infectious disease expert, joining us here in studio. And thank you for your participation. Excellent questions, and we hope we've been able to answer some of those for you. I'm Mike Killeen in the CBC Vancouver Newsroom. We'll see you tonight for CBC Vancouver News at 6. Have a great afternoon.